Hello, everyone. My name is Kim Sinnett. Thank you for joining us and welcome to the inaugural Central Texas Starting Well Educational Series. I'm going to be your hostess. As I said, my name is Kim Sinnett. I am the founder of the High Maternal Wellness Center. Before we get started, I'd like to give you an overview of the series. First, we want to give everyone space and permission. If you feel triggered or you need to leave, please feel free to do that and return as you need, because we might discuss some upsetting topics. As things come up, we will provide time for a Q&A at the end. So please type your questions in the chat. And if you want to ask someone specifically a question, if you want to address them, please add their name so that we know who you would like to answer you. We will answer as many questions as we can, and we will do that in order of receipt so that we can be respectful and end on time. Finally, you're going to notice that we are purposely leaving out introductions, but we have included slides with our bio and contact information. And again, we're doing that in the interest of your time. So back to the series. I am part of a group of Central Texas birth and birth adjacent workers, and we decided to put our collective efforts together to let our community know about all the amazing resources that exist outside of the hospital system. In case you're not aware, Texas mothers give birth to 10% of the babies in the United States. Yet, as a state, our maternal mortality rates and morbidity rates are pretty embarrassing. And according to the Texas Health and Human Services, as of 2019, the maternal mortality rate is 16.7 per 100,000 live births. So intimate partner violence and suicide are the top reasons for death. The Commonwealth Fund ranks Texas as number 50 in women's overall health care. And according to the March of Dimes, who is a national infant advocacy group, Texas received a D- for its newborn and maternal outcomes. Folks, women are dying here. And Black and Indigenous mothers are also dying at 2 to 4 times the rate of non-Hispanic white mothers. Mental health related causes are the primary reasons for all mothers, but for Black mothers, hemorrhage is a primary reason. So what can we do about it? We can educate, advocate, and encourage mothers and families to learn about other options. Safer options that decrease your chances for birth-related complications for you and your baby. Safer options, such as midwives and doulas. The reality is, midwives and doulas save lives by improving outcomes, like decreasing the incidence of cesarean sections, labor inductions and augmentations, preterm labor and, preterm delivery, low birth weight, and low APGAR scores. Plus, moms use less pain medication. They increase the incidence of VBAC births, which is a vaginal birth after cesarean section, and they have higher breastfeeding rates. In fact, the Johns Hopkins Bloomberg School of Public Health said that they created a tool that estimates that full integration of midwifery in the United States would reduce the maternal mortality rate by 82%. So while there are still barriers to us realizing and actualizing that end, we are here to discuss the here and now. So we have put together a wonderful panel, and we're going to be discussing our options in the community. I'm going to hand over the reins to Allie Weatherford, who will be our moderator. Thank you.
Hi, I'm Allie. I am a childbirth educator, and I'm also the director of parent education at Breastfeeding Success. So I'm here to introduce you to all of our other panelists to start. We have Kim, of course, who you just met, and Kim is a certified nurse midwife. She's a psychiatric nurse practitioner at the Hive Maternal Wellness Center. We have Melissa. Melissa Harner is a doula and a perinatal community health worker working both privately and with the Healing Hands Community Doula Project. That's a local nonprofit providing doula services to the local BIPOC community, as well as they have a doula training program. Michelle Cruz is a birth doula at Galactic Doula and the president of the Central Texas Doula Association, which is a really great resource for families to help connect them with doulas in the community. Ebony Williams is a birth doula and a childbirth educator and a placenta encapsulator working with Black Mamas ATX, which is a local nonprofit providing doula services and education and mental health support for Black mothers and families in Austin, Texas. Ruth Bailey is a licensed midwife and doula. Ruth founded and runs Ma Bailey Ministries. It's a nonprofit women's clinic and short-term housing facility. Ann Morgan is our final panelist. Morgan Miles is a birth worker, a social worker, and is the executive director of GALS. That stands for Giving Austin Labor Support. That's a nonprofit organization providing low or no cost birth and postpartum doula support. And they partner with the MHEC, the Maternal Health Equity Collaborative, to provide free childcare services also locally. And that's all our panelists. Next, I'm going to ask each one a question related to the topic that we're here to talk about today. And each person gets a little bit of time to answer those questions. Okay. So starting with Kim, could you please start by explaining the scope and role of a licensed midwife?
Yes. So the scope of a midwife is to provide the necessary supervision, care, and advice to a woman during normal pregnancy, labor, birth, and the postpartum period. They also conduct normal delivery of a child and provide normal newborn care for the first 6 weeks of life. Now, in America, we have a different midwifery system. We actually have two types, and they are a licensed midwife and a certified nurse midwife. And the differences primarily lie in the way that you get educated and then your scope of practice. So as you can see, for a licensed midwife, you need a high school diploma or a GED. And for the schooling, that takes, it is classroom learning as well as a 2 to 3 year long apprenticeship. And then with the scope of practice, kind of went over that, but they are allowed to practice in home birth or birth center settings. They have a certifying body, which is called the NARM, and that is basically the people that allow them to take the licensing exam and where they earn their credential. And as far as businesses go, they are able to own their own home birth or birth center practices. Whereas with a certified nurse midwife, they need to have a bachelor's of science in nursing or a BSN, or they can have a direct entry nursing program that they choose to use, but they, in essence, need to be an RN. And after that, they have to pursue a master's of science in nursing, which also can take 2 to 3 years. Their scope of practice, again, is identical, but their practice setting is a little bit more expansive. They are able to practice also in home birth and birth centers, but additionally in hospitals and clinics. And their certifying body is the AMCB, which is the American Midwifery Certification Board, and also their local state boards of nursing. As far as business opportunities, they also are very similar, also home birth and birth center, and additionally, they can practice in a clinic.
Thank you. Was that the end of yours, Kim? Okay, thank you. Next is Melissa. Melissa, a question for you. Could you please explain the scope and role of a doula and a perinatal community health worker?
Sure. Hi, everybody. Melissa Horner here. So what is a doula? A doula is a person who has taken a training program in how to help and support pregnant people and their families during the exciting but challenging journey of childbearing. Doulas are not medical professionals. We do not deliver babies or provide medical care. We operate in a non-medical capacity. And we do not speak for the family. Doulas do advocate for their moms and the families, but we never speak for the family. That is never a doula's role to come in and take over. We're there to support both physically as well as emotionally, and to help the mom throughout the labor and delivery through breathing techniques, massage, aromatherapy. You just really get to know your clients, and then you know what to do in order to keep them calm and try not to freak out during the birthing process. Um, Doulas also encourage women to use their natural power within, because it is every woman is strong in their own right, and we want you to have a baby without drugs. If you don't want to use the drugs, if you do, we do not judge. Drugs were made for a reason. I had an epidural. Um, so we're here to help support families. Now, what is a perinatal community health worker? That is something that we at Healing Hands are trying to kick into gear. It's basically where, oh, bottom slides are cut off. It's basically where you are trained as a doula, but also as a community health worker. How does that impact you as a doula? Well, having your own personal business, we can now build through Medicaid to be reimbursed for our services. And that does also include some of the doula services as well as postpartum. With Healing Hands, we see our clients between 6 to 25 weeks. That's when we get started. They're always welcome to reach out earlier, but between 6 and 25 weeks is when we take on families. We don't want to go past 25 weeks because we really hone in with our clients. We become a part of their village. We educate them. That is part of a doula's purpose, right? We educate them. We provide resources. Since most of our families are at or below the poverty line, we will want to make sure that we empower them with the tools and resources that they need in order to sustain their health and wealthiness. And I'm done.
Thank you. Okay, next we have Michelle. Hi, Michelle. Could you please explain how someone can find a doula or refer someone to a doula through the Central Texas Doula Association?
Yes, so we'll discuss that, and then we're going to dig into these slides I have here. Central Texas Dual Association is a wonderful website that has the ability for folks that may have opportunity to pay for doula support to find local independent doulas and doula agencies. So our website is easy. It's CENTX, so CENTX doulas.org. We have a great button that says Navigate for Parents, find a doula tab. On that tab, you click on it and you see all the birth doulas that are in our association. It is by choice that doulas in Texas, Central Texas join our association. So you may not see everybody, but that's totally fine. And then if you're like, I don't quite know who to work with, I don't know what I need, we have a special request tab where families can go ahead and write into us and say what they're looking for, what their budget is, what part of town they're in. Do they need birth or postpartum support or both? And then we can connect that with folks in our association. The cool thing about our website is it gives us a directory visible to see all of the doulas that are available, their profile picture, their photo information, any extra experiences that they have, and then all their contact info. So if you're like, I want to contact people directly, you have the ability to do so. And the cool thing is it's like a local support network. So our doulas work with each other, offer support and care. It is a provider-free space, so it's literally just doulas that are in this association. And we like to make sure that folks know what we can and can't do, what we offer, and how to find care for birth and postpartum and beyond. We have lots of doulas that are doing other things too. And so if you look at the bios, you can see the opportunities that are available to each family member looking for support. Now let's dive into these amazing but tragic graphs we have here. And so I'm going to talk a little bit about how the Black and brown parents can be prepared for complications and frustrations in giving birth in Central Texas, and what us doulas and midwives are already doing, and how you can see that work coming into supporting families. And so we've, as Kimberly mentioned, we are already 3 times likely to die from pregnancy-related causes than our white counterparts, and Hispanic women are also at an increased risk. And so as you can see here, from 2018 through 2020, look at that massive jump in the US mortality rates. This is continuing to go up. So we're sitting at the cusp of 2025. Who knows that number is going to be at right now? And we know this is coming because of complications of access to care, higher rates of complications. And we're seeing this happen even with folks that have access to care, but even those in underserved areas are having lack of access to care. There's a whole thing listed that says 80% of maternal deaths in Texas are preventable. So this is massive information. And so if this is the first time you're hearing this, I'm so sorry. Like, we're all working hard to prevent this. But the biggest part of this is what I like to say is the quiet part out loud. Systemic bias and discrimination, and including implicit bias, is what's causing a lot of this. A lot of folks are being dismissed, their information is being delayed, diagnoses are being ignored, and they're not getting adequate care due to those things as discrimination and implicit bias. So what the heck is implicit bias? That is that hidden, unknown thought that someone is acting in a certain way without acknowledging that they are treating people differently. And so we're even seeing that this Black women are feeling unfairly treated in their care, in prenatal visits, not even in the birthing process. So you're like, okay, thank you for telling me, but what can we do? The role of doulas and midwives, as we've mentioned, advocacy. Providing that advocacy piece is so important. And that's why a lot of us in this call here are really pushing for folks to have doula support and seek supports outside of the healthcare system, and doing home births and doing birth center births. And so advocacy is huge, helping them know that our clients can connect with each other, and that then they can know that there's opportunities for them to be able to speak their mind, ask for more time, be able to connect with others and see, hey, you know what? That happened to my friend. I don't want that to happen to me. I also like to say saying their name, letting folks know that they have the opportunity to say, you know what? I heard about a story in New Jersey. I don't want that to happen to me. It's happening right here in Texas. You don't even have to go across the state. And so access to support. So culturally sensitive support. A lot of us here know who's offering culturally competent care in Central Texas, which hospitals are good to go to, which areas we can go to, and then letting them know that there is a possibility of complications in any pregnancy. And so just that education piece of knowing is key. So everyone here, we all know what they possibly could be. Preeclampsia, it could be gestational diabetes, early birth, preterm birth. It's just letting them know, and then helping them to have education. All of this reduces anxiety. So I always say the sooner you educate someone, the next generation is even more protected. And this happens through that empowerment piece. And so please let people know that just telling them that I see you, that's great, but say, I want them to hear you too. And so we're trying to provide a culturally respectful environment, trauma-informed care, open communication with the folks that are on this call and with the providers, and then making sure that those of us here continue to do our birth justice support, partnering with community organizations. All these things connect, and they all intersect to reduce the racial disparities. And saying these things out loud is what's the most important thing. And I could talk about this for a long, long time. So I made a link you'll see in here of more information. If you want to go to the next slide really quick as we wrap up this portion, it'll show you some more visualization of this information. So this is per 100,000 live births. This is so massive, this 3 times more likely. And this mortality risk is impacting so many people. And then the next one shows what you mentioned about, US being 50th on there. Look at the difference of these industrialized organizations and nations, and how we are literally nowhere close to the rest. So this is not just Central Texas, but nationwide. We're trying to address this mortality rate. And by just letting people know there's a way to connect, and by getting dual support, and by getting organizational support, which we have all these amazing resources right here in this call, can literally save someone's life and bring a family home whole.
Thank you, Michelle. Next, we have Ebony Williams. Could you please describe a day in the life of a doula? and how families benefit from doula services.
Hi, everybody. Yes, I definitely can. I wanted to start off by saying I think it's very important that we understand that the day in the life of a doula is going to be different from doula to doula, especially given the type of training that that doula has, additional training that that doula has. It could be a little different. But for me as a doula, my day-to-day pretty much looks like either hosting or holding prenatal appointments with my clients. In those prenatal appointments, we are talking about anything from their fears, what their previous birthing experience was, what they'd like to implement in their current birthing experience that they didn't get in their last experience. We are identifying resources and needs that these individuals may have, whether it be needing access to healthy foods, needing baby supplies, needing maternal supplies, and getting those things into place for those birthing families. Childbirth education is a huge part of the support perinatally that we're providing or that I'm providing to my clients. So talking through with them what it's like birthing in a hospital setting, what are medical interventions that could be offered to them, what are their options, talking through and educating them on their body, what the process of labor is, what is happening to your body. So, if you have a bloody show, this means this is happening to your body so that they are able to kind of understand and not have fear around the birth process, but having that education to be confident and secure and knowing what is happening. Sometimes my day may look like attending a client's not hospital, but doctor's visit with their OB. I have some clients who maybe may not understand what's being recommended for them, or there may be some medical jargon where they're not understanding what this term means. So I'm there to really talk through and explain what the doctor means to them, encouraging them to ask questions that they need to ask to clarify. I help with creating a birth plan, just understanding what the client's birth preferences is and how I as a doula can best support them. So that again goes to understanding what their fears are, what may have happened in their previous pregnancy, what they want to implement into this next birth or labor process and labor prep. So we're also talking through when they do go into labor, signs of early labor, understanding complications and red flags that could happen. With Black Mamas ATX, we are doulas. We have doulas in the organization, but all of us as an organization are maternal health equity advocates. And so a huge part of our work is talking through with our families about the complications that we see with Black birthing people. We are talking about what they are more at risk for: gestational diabetes, high blood pressure, stress. When we talk about the highest rates being suicide and mental health and domestic violence, we are addressing those things. We are providing mental health support through therapy for our clients. We're connecting them to all of these things and trying to identify that so that they can have a successful pregnancy and not have those stress-induced complications and things of that nature. And then as a doula, I'm also attending the birth. That's the beautiful part of the work when you're doing the birth. And in that space, we are providing emotional support. Sometimes things don't always go as planned. So we're there to help kind of normalize things, talk through things, give options to our clients. We are there to provide pain support, pain management, help them with movement. A lot of times folks in the hospital may just sit in a bed. I'm a doula that is going to get you up, get you moving, get you in positions, if you can, that are going to help, optimal fetal positioning and get things moving for you, and education. And so that's kind of the scope of the day in the life for me. I also do postpartum visits, and in those visits, I'm doing anything from helping mom and or father and or partner acclimate into the space as new parents, whether it be lactation support, latching, questions they have about baby, any of the things, making a herbal bath sits to help mom heal after a C-section, all of the things. We're doing those things to just check in and to make sure that they're okay postpartum. And if they need any additional support, we are there to identify that. And if we don't have the resources, helping to get them connected. We work heavily in the maternal health equity collaborative. So there are many resources that we have to offer for our clients.
Thank you, Ebony. Okay, next we have Ruth, and our final panelist. So Ruth, as a midwife, in your role as a midwife, could you just kind of talk to us a little bit about what that's like as a home birth midwife, how you collaborate and coordinate care for your clients?
Yeah, definitely. So midwifery care outside of the hospital is a really great option for many families. And I know that Kim already spoke a little bit about this. But so midwives specialize in low risk pregnancies, and they're also very skilled in keeping pregnancies low risk. So they can handle several variances of normal, such as IVF or mothers who are over 35 or 40, and other situations like some midwives can do twins or breeches and different varieties of normal in birth, depending on that midwife's training. Our training is a little bit different than obstetric training. So care with a midwife, it includes the same standard testing that OBs have, such as lab work, pap smears, urine testing, ultrasounds. We can refer out for those, blood pressure checks, checking on the baby, and everything else. In addition to these checks, your midwife prenatal visit is usually around 30 minutes to an hour long, depending on your midwife. And they have a focus on nutrition, the mom's emotional well-being and stress level. Some do some childbirth education and extensive postpartum preparation, where the majority of maternal deaths do occur postpartum after discharge from the hospital. The goal of midwifery care is to keep the stress levels low for the family and then screen for abnormalities and then bring things back onto a low risk clinical picture. And that can be through use of different herbalism, homeopathics, body work, just different modalities all along their scope. And with suicide being a leading cause as well, having this partnership with your midwife who's going to be attending your birth and walking you through postpartum, that dramatically decreases depression, aloneness, and other causes that can cause mental health concerns as well. So usually prenatals, they're done at a midwife's office or at a birth center. And families with some providers, they can pick to have a home birth or a birth at the birth center. It depends on that midwife and what her resources are. And they follow the same schedule as the typical prenatal schedule, where it's once a month and then every 2 weeks, then every week at the end of the pregnancy. And the postpartum care with the midwife is what really is different. That's why, going back to another person's presentation, if we integrate midwifery care more in the US and here in Texas in Williamson County, we are going to see a decrease in complications because midwives typically check on their families anywhere between 3 to 4, sometimes 5 times within that first 6 weeks. So it's much more comprehensive on breastfeeding support, emotional well-being, looking for bleeding that's too much, looking for infection, checking out baby, and keeping the family at home versus back and forth to the pediatrician if needed, because the midwife can handle those. That's all in her scope, all those pediatric visits. So for the birth of the baby, families have several options. So most families choose to birth at home, where they order a kit and they get some basic supplies, and the midwife brings all the other medical supplies to the home if any emergencies do come up. Babies are monitored intermittently during the birth, the same way low risk labors can be monitored in the hospital. They're monitored intermittently there as well. If any complications occur at home, then the midwife tends to, our training is to transfer before things become catastrophic. Most midwives all have really good relationships with the hospital. There's a route to get to the hospital to get in and be seen very quickly and give report. The around 85 to 90% of births that are planned out of the hospital do end up being complication-free, staying at home, low-risk births. Of those 10 to 15% that do transfer to the hospital, the vast majority of those are non-emergent transfers. They are more so wanting to go and get medication to help facilitate rest, like an epidural, after a long labor. So those are non-emergent, non-urgent, just getting some therapeutic rest. Some families, actually, as another option, if they were planning on, if they had a midwife for traditional prenatal and postpartum care, they can also choose to do a planned transfer to the hospital. So if they want to have that comprehensive prenatal, comprehensive postpartum, but still want their baby born in the hospital, the midwife works together with the hospital the day of the birth to plan on the mom coming in, whether that be for a planned C-section or for a planned epidural, planned induction, or just that's where the family felt best. So we work together with the hospital staff in order to really come alongside and be like a tribe around that family so they can get the type of birth that they want in the setting that they want and also get all the other tools needed in their care.
Thank you, Ruth. And I'm sorry I misspoke before. You were not the final panelist. We have one more, Morgan Miles. Could you please tell us about a little more about your organization as a low or no cost option for doula care, along with any other programs that exist in Central Texas?
Yes. Hi, everybody. I am the executive director of GALS, Giving Austin Labor Support. And here in Central Texas, GALS has 5 programs to support birthing people, starting with our prenatal doula care. That's a model where it's like full spectrum care, starting in pregnancy, where we're matching a birth worker or a doula to a family to provide that one-on-one care through pregnancy, birth, and postpartum, as the other doulas on this panel have shared. Also providing that wraparound social determinants of health perspective. So being able to connect families to resources in the community to aid and other needs that they have regarding food, housing, transportation, et cetera. We also have an on-call program. So that means that people who are in labor and realize that they're in need of more support, or who are scheduled for an induction and realizing I need a doula and I didn't know that I needed one, they can call our 24/7 dispatch number, and I'll put that in the chat when I'm done speaking. And that allows us to connect them with a birth worker within 1 to 3 hours time, and provide that continuous care through their the rest of their labor and into the immediate postpartum. Our postpartum doula program continues that care, so in-home care for 24 hours per month per families, and are able to kind of continue to support that healing, rest, and transition into parenthood. We also have a jail support program where we're working with folks who are incarcerated in the Travis County Correctional Complex, providing support groups during pregnancy, education, fresh fruits and vegetables, and community, as well as going with them if they are to give birth while they're still incarcerated, so that they're not alone through that process, and providing that postpartum follow-up care once they're back at the jail. Our final program is a partnership program with the Maternal Health Equity Collaborative, which you see here, the members of that organization. I'll talk more about them in a second. But they are able to, through that program, we're able to provide perinatal childcare to Black families during the perinatal experience. So families who are connected with one of these 5 organizations can access a doula or a childcare provider in their home for them to be able to access healthcare, mental health care, and as well as emergency-based childcare, such as during hospitalization or postpartum readmission. We know that in Central Texas, parents are often put into the Child Protective Services if they're admitted back to the hospital and don't have anyone to watch their child. or their newborn baby if they need medical treatment. And this was unacceptable to us. So we created a solution, and that solution is our perinatal child care program. Additionally, families can have access to further respite care in the postpartum to really aid in relaxation and healing, and be able to also continue to meet those appointments that they need to care for themselves and their family. So GALS works collaboratively, providing those programs to families at no cost. We have income-based guidelines for our prenatal program and our postpartum program, but the on-call, the jail support, and the child care programs are not based on income. Additionally, the child care program has a pilot that we're doing right now to expand that emergency-based childcare to folks who are BIPOC, Black, Indigenous, people of color. So other folks who are also disproportionately impacted by child protective services. As you've heard already from a couple of these organizations and their doulas and their amazing work as well. Black Mamas ATX, Ebony, you heard from her, but they're providing similar community-based care, so doula care, but also sister circles, community building, and mental health care. And then Mama Sana, Vibrant Woman, supports Black and other families of color, Black and Latina families, in providing doula care, as well as providing education groups, support groups for prenatal, support groups for postpartum, and many educational opportunities. And then Healing Hands, you heard from as well. We learned about them and their amazing work that they're doing, as well as providing doula care. They're also working on expanding that workforce. And that's super important in this moment where everyone deserves access to a doula, but the workforce of doulas is limited in the state of Texas. And then we've heard from, or we haven't heard yet from Partners in Parenting. They're a perinatal support group, and they're able to help families build that community that they need. All of these programs are free or for low cost, and are really grounded in and rooted in the community in which they're serving, matching families with birth workers who are culturally, ethnically similar to them, as well as have extra additional training in providing kind of comprehensive care in trauma-informed care, mental health care, etc. I also want to say one thing that isn't on here, but we have talked about midwifery quite a bit, and I wanted to also pull up there's a program in Austin that helps fund home birth care for families that can't afford it, specifically Black families. It's called Black Home Birth Matters, ATX. They're always accepting donations so that you can help sponsor families who might not have access to that out-of-hospital care, but can be crucial to improve birth outcomes. So doulas work collaboratively within the healthcare systems, but are independent from the healthcare systems. Doulas are helping to improve birth outcomes by empowering the health efficacy and knowledge of families to be able to advocate for themselves. And eventually, when enough families advocate for themselves to change policies in hospitals, hospital policies change and we see improved birth outcomes. All of us work together, whether we're working for one of these organizations or working as independent doulas, to help uplift the voices of the people who are giving birth and improve birth outcomes in that way. And with that, I'll pass it back to you.
Thank you for that, Morgan. That was awesome. Allie, would you speak to the importance of childbirth education, and please let us know about some of the low cost and free resources available to our community?
Hi, yes, sure. So like she said, I'm not a doula or a midwife. I'm here to talk about the importance of childbirth education. We do know that when people have more information, they can find out about more options for their care, for their families, that we do have better outcomes. So childbirth education is very important. I work for a company called Breastfeeding Success. I manage the parent education there. So we provide services teaching about birth, but also all kinds of other topics, especially breastfeeding, newborn care topics, new parenting kinds of topics. Our company believes that comprehensive education, right, encompassing everything is critical. We want families to feel informed and empowered. So we talk about having a healthy pregnancy. We have a course for that. It's a free pre-recorded course that's available just on our website. Because not everyone gets to hear enough about this during prenatal care. We talk about birth. We have classes about, like I said, breastfeeding and baby care, CPR and safety, things that give parents the tools to be the kind of parent that they want to be, and that they worry about and need some extra support with. We also provide this service to get families involved in their local community. So a lot of our panelists talked about that, about creating community, building community, which is really important for that after time, especially when they might not have all the support that they need around them from family and friends. We want them to have a familiar resource to reach back out to after they have their babies, when they need help with breastfeeding. We provide all of that. We can also help direct them to the right resources. We have, of course, lists of all the people here and more of things that families can access to help them after the babies come. In the past, I think, and still in a lot of communities, prenatal or perinatal education has been for people who have some disposable income. It's not usually cheap. Many families have to limit the classes they can take, or they don't take classes at all because of cost. Many private enterprise educators can't reach all that many families because they're not known well enough or recognized by large practices, birthing facilities. So we've been able to partner with large hospital systems and their associated practices of providers so that we can make this education more accessible to more people. Our classes can be found on many hospital websites. We're able to meet with the affiliated providers often so they can know what we offer and recommend our classes to their patients, and they often do. It's been really great, some great partnerships on top of that. Our classes are very affordable. So even if they have to pay out of pocket, they're very affordable compared to most that are out there. And often, I think even most often, our classes are free to the students. This is really amazing to me. I used to teach birth classes privately, and that meant a certain thing, right? They had to be expensive so that I could cover my costs. And that meant that my students were generally, coming from certain groups. They had a certain level of privilege to be able to pay for these kinds of classes. A lot of them were already coming in pretty well educated about a lot of what we learn in birth class. The breastfeeding success model, the way we work, means that I get to see a lot more diversity in the classes. I get to see people taking classes who wouldn't have been able to before because of cost or lack of visibility. And there are other organizations out there providing free or low-cost perinatal education, some that you just saw mentioned here up on the slides, and also groups like WIC and Any Baby Can. And these are fantastic options for many families, and possibly even more appropriate in some cases because it can help families connect better with their own specific community. There are some limitations, though. Sometimes there are very few educational topics offered or not offered often enough. Sometimes the criteria are a little more strict, so it might only be available in certain areas or for certain ethnic or racial groups or income levels, or only for people who qualify for WIC. And we need all of these organizations. We need all of these groups doing what they're doing. I like to think that Breastfeeding Success kind of helps fill those gaps because there's just been sort of a one or the other. And so needing to fill these gaps is something that we really are focused on. And we added education a little later in the game. Originally, Breastfeeding Success was a lactation consulting, just all lactation support. But then at some point, it became pretty clear that to be able to help people best, they needed to provide some prenatal education. We staff many hospitals with inpatient lactation consultants, IBCLCs, and they tell me all the time that they can tell when someone took a prenatal breastfeeding class. By the time they see them, they're already doing some of the right things to support their breastfeeding. They are also less anxious. So we have expanded beyond breastfeeding classes since then, of course, because we know that also supporting a healthy pregnancy can lead to better birth outcomes, and better birth outcomes can lead to better breastfeeding rates, healthier families overall. We include other classes for new parents to continue supporting them, because healthier, more confident parents can raise, of course, happier, healthier kids, and so on and so on. So we know that those meaningful interventions in the life of young families can lead to community and cultural evolution. And we have to offer interventions that are more accessible to more people. So with that in mind, we offer virtual and in-person options, and those have all been very successful. People really do engage virtually. That can help when people have issues with childcare, things like that, transportation. So we're seeing a lot of combined, we're doing a lot of both. Our classes are evidence-based, so we do partner with many hospitals. We don't teach to any particular test. We can't. Every facility, every provider is different from the next. So our goal is to provide broad evidence-based information, and we want people to feel good about their choices. So showing them that what those options are, how to communicate, how to have better communication with their providers, and about their options, so they can continue to participate in their own care. And that's all I have. Thank you.
Thank you, Allie. So now is time. We have a few minutes for Q&A. I did see a question in the chat. Somebody wanted a summary of the Maternal Health Equity Collaborative. So Morgan, could you answer that question for us?
Yeah, so the Maternal Health Equity Collaborative is a group of 4 community doula organizations and 1 parent support organization: Black Mamas ATX, Mama Sana Vibrant Woman, Healing Hands Community Doula Project, and GALS, as well as Partners in Parenting. We came together during the COVID-19 pandemic as a way to advocate for doulas not being kicked out of the hospitals and ensuring an equitable response to COVID-19 in the city of Austin and surrounding areas, specifically with pregnant folks. What we've done is our organizations all meet for almost 2 hours every single week, and have several different off meetings where we are working together to improve outcomes for Black and Brown families in Central Texas. So we know that by centering the experiences of Black and Brown families, the outcomes and experiences of all families improve. But because Black families are facing the most desperate health outcomes, we have to center Black families in this. So the MHEC is run and led by Black folks and people of color who are dedicated to this work. And we all work together to kind of streamline our services, ensure referrals, ensure we're working together, and fill in gaps in care that we're seeing specifically related to perinatal care. We're thinking about birth worker sustainability. We're thinking about power building and organizing, because we know that systemic issues need both person to person as well as systemic solutions. And so really thinking about how to leverage community voice on a big level to be able to really impact outcomes for families.
Thank you. And if somebody wants to get involved, or I know you have the community days, or learn more, what is the best way to reach out?
Yeah, so if you go to mhecatx.org, you can sign up for our newsletter there. We have our community baby shower coming up on October 19th in the afternoon. That is a free space for families to be able to come and get new and gently used items that they need to support their growing families. We also have community days where folks who are also working in the perinatal health space can join our meetings and get to know each other, network, and understand more about our work. We'll also be having some advocacy days and things like that coming up as the next legislative session is around the corner. So you can follow us on social media. MHECATX is the and keep in touch with us via our listserv email. We'll be sharing out more.
Thank you, Morgan. Are there any other questions if you'd like to come off mute or share in the chat for anybody on the panel today? Well, if you do think of something, feel free to reach out. We will be sending a follow-up email. I will now pass it back over. We have a few things that we'd like you to please help us with. Let's see, who is sharing the...
Kimberly, if you can come back on.
Kimberly. Yes,
Sure.
Kimberly.
Yeah. So, wow. First, I just would love for everyone to give all of our panelists a virtual hand. There's a reaction button at the bottom where you can do a little hand clap. So please do that. And thank you so much to all of our panelists for imparting us with your wisdom and offering us your support and just letting us know that you exist. And finally, thank you to you, our audience, for joining us today. We do hope that you have learned something. And speaking of learning, we do kindly ask that you do complete a survey for today. We do welcome all feedback and suggestions because it will help us improve. We are here to meet your needs, and so your feedback is actually going to drive the direction of the series. So, we'd love to hear about what you want to learn about. That's kind of really, really important to us. These ladies did give us a taste of some great work being done in our communities, and we do want to build on this momentum. So we do have a goal of doing regular series, probably quarterly initially, and then to increase the frequency as the demand grows. So please, please, please help us get the word out by posting it on your social media channels and websites and telling your colleagues and your communities. Together, we do have to be the change that we want to see. Thank you all so much for attending. Have a great day and stay tuned.